Lovely. So like I said earlier, we want to discuss mental health, but we're just going to divide it into 5 sections: the definition, the background, substance abuse, what to do, and the resources. So to begin with, maybe we can start with an introduction of the topic. There is no healthy body without a healthy mind. Now, if you look at the story of the Good Samaritan that was shared by Jesus, disciples came to him asking, I think that's when he was teaching about love, love your neighbor as you love yourself, etc. And then they asked him, so who is my neighbor? And then he gave them the parable of the Good Samaritan. And from the parable, we can learn that he depicted neighborly love as having to assist others in times of need, in the way the Good Samaritan did it. He gave first aid, and he took the individual who had been attacked to professionals for even more help. So likewise, in this day and age, it is very important that we show the same love toward others in our circles, not just in their apparent need for physical well-being that we are always seeing, but also in the not so obvious mental health related issues. So to begin with, did you know that globally, 1 in 7 10 to 19-year-olds experience a mental disorder? So today we just want to talk about the importance of mental health among young people in Zimbabwe or in any other place, and what we can do to support and promote it. So the first section, as we said earlier, is definition. So what is mental health? So it is a state of, so this definition is coming from World Health Organization. They have defined mental health as a state of mental well-being that enables people to cope with the stresses of life, to realize their abilities, to learn well and work well, and to contribute to their community. It is an integral component of health and well-being that underpins our individual and collective abilities to make decisions, build relationships, and shape the world we live in. Mental health is a basic human right, and it is crucial to personal community and social economic development. As you can see from this WHO definition, mental health encompasses all the facets of life as we know it. To start with, it's not just about the mind. The mind needs to be well, and the mind needs to cope with stresses that affect us on a daily basis. When the mind can cope with all of that, and when the mind is well, it then allows us to realize what we can do. It allows us to learn well, so that includes the education, the training that we have to go through. It allows us to work well, so that includes our work, and it allows us to contribute to our communities, which I think most of the work that you guys in this meeting are doing in your communities. And then they go on to define it as being integral to our decision-making processes. Mental health is integral in relationship building. It's integral to how we can shape the world we live in. And then they also define it as a basic human right, and how it is crucial for development, either personally or community-wise or even socio-economic. So I'm sure we can see from this definition that it covers all facets of life generally. And it's very, very important that we take note of these things. And then they also say that mental health is more than just the absence of mental disorders. It exists on a complex continuum, which is experienced differently from one person to the next. And then it's also important that you know all of these things. Mental health is very, very important, very, very vital. So now we want to move to the background. So why do we want to speak about it? So there is a report that the UNICEF did on mental health in adolescents and young people in Zimbabwe. And they noted these following points. Number one, that depression is one of the leading causes of disability in Zimbabwe. They noted that suicide is the second leading cause of death among 15 to 29-year-olds. They also noted that people with severe mental health conditions die prematurely. So it's such a very important issue when we see, such numbers being the second leading cause of death in this group of individuals. And then adolescents and young people's well-being requires urgent attention. Violence is at epidemic proportions and critically affects mental health. Not only that, but substance abuse is also at critical levels in this time. Day in, day out, we are hearing stories of drug abuse among youths in schools, in colleges, and things like that. And I, for one, I'm working in a casualty, in the casualty department or emergency department of one of our biggest hospitals in the country, the biggest government hospitals in the country. And you will realize that on a daily basis, I see beyond at least two patients who are coming in with substance-induced mental disorders. So it's really quite a challenge at this moment. The other thing that they noted in the report was that the consequences then include eating disorders, suicidal thoughts and attempts, low self-esteem, poor emotional well-being, and substance abuse, risky sexual behavior, teen pregnancies, and STIs. And then access to health services by these adolescents and young people is hindered. And then lastly, they also noted that mental health issues are acknowledged by adolescents and young people as a rampant problem, but they are buried by stigma. We have a lot of stigma. I don't know if it's a cultural issue. It could be a cultural issue. I think culture denotes that we need to be strong, we need to be mentally strong and things like that. And when you exhibit signs of mental health illness, sometimes people will overlook it for being weak, or sometimes for being demonic, or for being, under some sort of spirit or things like that. So this then is the discrimination and stigma that then affects youths to try and seek help when they need it.